and visible? Let us know, then we'll start. Are we audible and visible?
Okay, so myself, Dr. Shital Ghataliya.
I'm Dr. Dipti Karya.
Welcome on the platform of Unacademy.
We are your faculty for physiology.
I did MD Physiology from MP Shah Medical College and having teaching experience of more than 17 years.
And I have done MD and PhD physiology and associate professor, and we both are educating MBBS nursing physiotherapy and MD students. We have teaching experience of more than 17 years.
Let us go through some subscription details of Unacademy. With Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. You can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank having more than 25,000 questions in it, and you can even have a printed notes available with certain subscriptions.
Where other subscription, that is iconic subscription. Here your access to the best from two of the best. And which are these two? One, that is Unacademy and Prep Ladder. With Unacademy, all the features are already explained. And second, that is Unacademy and Prep Ladder with Prep Ladder. Here you can have clinical and integrated essentials, video lectures from the Dream Team, question bank 3 with active guidance, system tags, and more, rapid revision and snapshots and treasures, and 2021 Dream Notes.
Now Unacademy came up with some special class feature. Now what is this? Here the classes will be highly interactive. There will be a poll for the learners. You can raise the hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available. You can download it and you can even have access to the recorded sessions. You can attend the classes from anytime, anywhere.
Also, we have updated and highly effective question bank, which is having more than 25,000 high yield clinical questions. These questions are based on latest exam pattern and it includes detailed explanation too.
These all are toppers of NEET PG September 2021. Congratulations to all the toppers from Unacademy.
As well as FMG December 2021 toppers.
So now there are two batches. Focus FMG 2022 comprehensive batch. Duration is 6 months. Already started from 15th of December. Target NEET PG 2022 taste and discussion batch. Duration is 3 months. Already started from 15th of December.
Also, we have started from 9th February NEET PG 2022 high yield MCQ marathon batch and Focus FMG 2022 comprehensive batch. And the duration for this is 4 months, and for NEET PG 2022 MCQ marathon batch is 1 month.
NEET PG 2022 image-based question batch, duration is 1 month. NEET PG 2022 ultra-fast revision batch, duration is 1 month.
Also, we have target next integrated system-wise batch 2023, and this is started. This has been started from 9th Feb 2022, and this is for 1 year.
Iconic price drop alert is there with NEET PG iconic subscription. There is a change in the prices. You can check with the duration and the newer prices.
So you can subscribe. You can subscribe from your mobile. You can subscribe for Plus or iconic subscription, and you can use our code either Dipti10
or Shital10
to get 10% extra discount. Longer is the duration of subscription, cheaper are the rates, you can see here. So if you are first or second year MBBS or other medical faculty student, you can subscribe for long duration.
So All India mock test is there, which is powered by Unacademy. On the popular demand, it has been extended to 26th of Feb at 9 AM. Use the code NPG10 and unlock the free plan.
This we have already discussed. Another announcement here is we have Study With Me pediatric test series that is scheduled tomorrow at 11th Feb at 10 PM. Okay, so you can also enroll for this test and you can get a chance to win Amazon gift voucher. Rank 1 gets the voucher of 5,000 rupees, 2 3,000 and 3 gets the voucher of rupees 2000.
So boost your medical NEET PG preparation with the amazing offer. You can have buy these 3 month subscription for today and get access of 1 month free.
So now we come to our today's topic, that is clinical based MCQs from physiology. Okay, why this is so and what is the importance of this clinical based physiology MCQs. Okay, so nowadays students are more focusing on NEET UG, NEET PG, that is based on MCQs. Okay, so many students, they are asking us that, ma'am, from where should we start our preparation regarding NEET PG, from the first year, from second year, or final year, or when? That is most of the time one of the question. Okay, but as you have taken admission in the medical faculty, whether you have taken admission in the MBBS, physiotherapy, nursing, dental, homeopathy, Ayurvedic, you have to study two basic, or you can say three basic, but these two are the base: anatomy and physiology. Okay, so these are the basis of your medical study. Okay,
So these are the base of your medical study. If you have not prepared these subjects well, you will not be able to understand your other medical subjects of second and third year and so on. It will affect your PG preparation also. There are many students, बहुत सारे students हैं जो पूछते हैं कि मैम नीट पीजी का प्रिपरेशन कब से करना चाहिए, पहले ईयर से करें, लास्ट ईयर से करें, इंटर्नशिप में करें, कब करें. So the answer is always prepare for the MCQs and all the subjects simultaneously. It means you are supposed to start your study from the first year itself. It will make you very easy to understand everything. अगर आपके basics clear हैं, basic subject आते हैं, then you will be able to correlate it. For example, अगर आपने कोई topic physiology का आज पढ़ा हुआ है, try to complete the MCQ today itself.
now, so here on the with the platform of Unacademy, as we have started Unacademy Future Doctors, that is our channel. Here we are providing practice of MCQs along with the topic. So our teachers, our topmost educators, they guide you how to prepare MCQs along with the topic. So simultaneously we are teaching topic as well as we are also preparing students for MCQs also. So this guided study, that is always beneficial. So we advise you to study with us. It is not like that this guided study as well as regular study. Like suppose you have studied one topic, along with that you have studied those MCQs from the very first year. So this becomes easy for your NEET PG preparation from first MBBS or first year of medical studies. Okay, so this will enhance your preparation.
So very important thing to discuss is in first year students are not guided properly, so it affects your study right now and it will hamper your performance this year also and later on also. So here you are supposed to have a proper guidance and we are going to help you for clearing the base of the first year. Okay, and it will help you to learn the other subjects because these subjects are aligned horizontally as well as vertically, so it will help you to understand that subject later on also.
So let us start with our MCQ session. We have prepared some MCQs here. We are trying to give you a view that which type of MCQs, clinically based MCQs from the subject physiology will be asked. Okay, so starting with first one, let us start with the first MCQ. Here you can see the question is, a muscular man weighing 80 kg has hematocrit 45%. So now calculate plasma volume. Okay, so here you can see, so blood volume, I will just explain you with the formula. Blood volume is equal to plasma volume divided by 1 minus hematocrit. Okay, so hematocrit is given. This is in percentage. Here when we are making it 1 minus, so this is, you can see here, plasma volume we require to calculate. Okay, so now what we have to make the formula like this: plasma volume is equal to blood volume multiplied by 1 minus hematocrit. Okay, so now blood volume, that is normally 8%, 7 to 8% of body weight. Body weight is given 80 kg. Okay, so 8% of this 80 kg, that is from 100 it is 8. So from 80, how much? That is 640 upon 100. that is around 6.4 kg. So this is 6.4 liters. Okay, that is your blood volume multiplied by 1 minus hematocrit 45%. Here this is 0.45. So your value would be 6.4 multiplied by 0.55, and the value is approximately, this is around 3 liters, so 3520 ml. So this is your value of plasma volume. Okay.
So this is again an important, you can say, the calculation based MCQ. There are many calculation based MCQs in which, you see, in other way it may happen that you are supposed to calculate the blood volume. If plasma volume and hematocrit is given, and if weight of the person is not determined, okay, in that case, if these two values are given, then you can calculate the blood volume also. So retrogradely also the question can come to you, right? Like here the link is given about weight, so you can calculate the blood volume. Same time, if plasma volume and hematocrit is given, retrogradely the answer question can be asked in another way, that you calculate the blood volume. So that is another way of asking the question. Now come to the second MCQ. Second MCQ here is 30-year-old men when exposed to the cold environment, feels shivering. Okay, feels shivering to maintain the body temperature. It is an example of which type of mechanism? The options are negative feedback mechanism, positive feedback mechanism, feed forward mechanism, or none of these mechanism. Negative feedback, positive feedback, feed forward, or none of these. So here the correct answer is feed forward mechanism. Okay, now why is this? See, in the question what has been mentioned is कि जब कोल्ड एनवायरनमेंट में एक्सपोजर होता है तब शिवरिंग हो रहा है, राइट? तो नेगेटिव फीडबैक जो है वो किस तरह से वर्क करता है कि जो स्टिम्युलेशन है, उस इनिशियल स्टिम्युलस जो है विच इज ब्रिंगिंग द रिस्पॉन्स, इट विल इनहिबिट द फर्दर स्टिम्युलेशन. तो ग्रेजुअली जो रिस्पॉन्स है वो वीकन हो रहा है, राइट? अगर पॉजिटिव फीडबैक मैकेनिज्म है तो इनिशियल स्टिमुलस जो है वो रिस्पॉन्स, उसके बाद जो रिस्पॉन्स जनरेट होता है, द जनरेटेड रिस्पॉन्स विल कॉज फर्दर स्टिम्युलेशन. Okay, so it means it is strengthening the response. Feed forward mechanism is also known as anticipatory control. Okay, it is also called as the anticipatory control. So here whenever the body temperature fall, जब body temperature fall होगा, at that time what will happen? Hypothalamus hypothalamus will anticipate the core temperature, okay, core body temperature, okay, and it will not allow it to fall, okay, because hypothalamus will sense कि भाई body temperature जो है ये कम होगा. So by these mechanism shivering, it will maintain the body temperature in the particular range. Okay, so this is an example of feed forward mechanism. Okay,
Next MCQ, that is, let me read. 40-year-old male diagnosed with Addison's disease. Which of the following is not true? Okay. Now here Addison's disease, that is chronic adrenocortical insufficiency. Okay. Now let me tell about the MCQ options. One, that is intracellular fluid osmolarity decreases. Option B, intracellular fluid volume increases. Option C, plasma protein concentration increases. And option D, that is hematocrit decreases. Okay, so here mind this is, we have to find out not true. Okay, so starting with this Addison's disease, as I told you, that is chronic adrenocortical insufficiency. So what happens in case of chronic adrenocortical insufficiency, Addison's disease? There is loss of sodium chloride by kidneys. Okay, so when sodium and chloride ions are lost by the kidney, what happens? Osmolarity decreases because of lack of this solute. Okay, so that is true, osmolarity decreases. First, there is decrease in the osmolarity of extracellular fluid. Okay, and when extracellular fluid hello good evening.
Good evening, Achan Khan.
Okay. Extracellular fluid osmolarity when decreases, then from intracellular fluid there is movement, and that results in decrease in the intracellular fluid osmolarity. 2, shift of the fluid from extracellular compartment to intracellular one. Here this is extracellular, this is intracellular. Okay, so there is decrease in the osmolarity of intracellular fluid. And as fluid shifts, the volume definitely decreases, intracellular fluid volume increases, because of decrease in the osmolarity. Then third, that is due to decrease in the extracellular fluid, as we have discussed, volume, there is increase in the relative increase in the plasma protein concentration. So this is also correct. And here fourth option, that is hematocrit. Hematocrit will not decrease, rather relatively hematocrit is increased. So this option is not true here in Addison's disease.
So whenever the MCQ is asked like not true, which of the statement is not true, which of these is a false statement about this, so you need to correlate the answer. पहले MCQ पढ़ के आपको extract actually करना चाहिए कि true, false, not true. तो ये distract करने का एक way है, right? So sometimes very hurriedly when you are trying to read MCQ, we don't focus on the negative part which has been given.
You can answer first one.
अब सबसे पहले अपना आंसर जो है वो गलत हो जाता है कई बार. ओके, एंड यू कैन इवन लिंक अप, ये सारी चीजें जो है वो लिंक अप भी कर सकते हैं. वेरी क्विकली आप सॉल्व भी कर सकते हैं कि भाई
that Addison's disease है, तो that is loss of sodium chloride first. When sodium chloride are lost, first extracellular fluid, this sodium chloride concentration decreases. Then as extracellular fluid decreases, there is movement from intracellular. So there is intracellular fluid osmolarity, because of loss of ions, it decreases. And when ions are reduced, then you can say that volume increases relatively. There is relative increase. So this way you have to interact, or you have to intercorrelate these options. Okay, so this and this one is not true.
Yes, so they very quickly even you can prepare a box like this कि भाई अगर लॉस ऑफ NaCl हो रहा है एक्स्ट्रा सेल्यूलर फ्लूइड में से, इसका मतलब कि यहाँ पे ऑस्मोलारिटी जो है वो रिड्यूस हो रही है, इसका मतलब रिलेटिवली फ्लूइड वॉल्यूम जो है वो बढ़ जाएगा. सो इट मीन्स कि फ्लूइड जो है वो शिफ्ट होगा, जहां पे भी फ्लूइड ज्यादा है वो दूसरे कंपार्टमेंट में शिफ्ट होगा, तो इंट्रासेल्यूलर फ्लूइड वॉल्यूम जो है वो बढ़ा देगा. अगर इंट्रासेल्यूलर फ्लूइड वॉल्यूम बढ़ जाएगा तो इसका मतलब है कि
relatively protein concentration that increases because volume decreases. Okay,
yes, यहाँ पे फ्लूइड शिफ्ट हो रहा है तो प्लाज्मा प्रोटीन का कॉन्सेंट्रेशन और हेमेटोक्रिट वैल्यू रिलेटिवली यहाँ पे बढ़ जाएगा, और क्योंकि यहाँ पे शिफ्ट हो गया है फ्लूइड तो रिलेटिवली इसकी ऑस्मोलैरिटी जो है वो कम हो जाएगी. तो वेरी क्विकली आप बॉक्स प्रिपेयर करके इसको सॉल्व कर सकते हैं.
नेक्स्ट इज
20-year-old female slept by keeping her arm under her head while watching movie. Now she developed tingling and numbness over the arm. Okay, which grade of nerve injury is this? Okay, the options are first degree injury है, second degree injury है, third degree injury है या fourth degree injury है. Now let us understand these all four grades of injury. अगर first degree nerve injury है, in that case nerves are intact, right? तो अगर कोई भी प्रॉब्लम हो रहा है, thank you so much Adarsh for your words. We will definitely do this frequently. Okay, so first जो है उसमें nerve जो है वो intact है. Okay, the only thing is here there is something compression होगा. Okay, so because of the compression simply it will cause ischemia for a while. जब compression release हो जाएगा तो जो भी प्रॉब्लम हुआ था वो रिकवर हो जाएगा. ओके, तो इसका मतलब है कि फर्स्ट डिग्री इंजरी होने की पॉसिबिलिटी जो है वो ज्यादा है. ओके, देन द सेकंड वन इज सेकंड डिग्री इंजरी. सेकंड डिग्री इंजरी में क्या होता है, देयर इज इंजरी टू द एक्सोन. एक्सोन को इंजरी होता है बट एनकैप्सुलेटिंग जो भी स्ट्रक्चर्स हैं जो कैप्सूल कर रहे हैं उसको कोई प्रॉब्लम नहीं होता. ओके, पर यहाँ पे क्या बोला है, किसी भी चीज की इंजरी के बारे में बात नहीं हुई है। सिंपली ऐसा बोला हुआ है कि भाई प्रेशर आया है, उसकी वजह से टिंगलिंग नमनेस हो गया है, राइट। वाइल कीपिंग द हेड हैंड अंडर द हेड इट विल हैपन कंप्रेशन ऑफ द नर्व। सो करेक्ट आंसर जो है वो फर्स्ट डिग्री इंजरी है। अगर थर्ड डिग्री इंजरी होगा तो एक्सोन को डैमेज होगा, उसके साथ साथ एंडोन्यूरियम जो है वो भी डिसरप्टेड होगा। ओके, पर एपिन्यूरियम और पेरिन्यूरियम जो है वो इंटेक्ट होगा। ओके, फोर्थ डिग्री इंजरी अगर है तो उसमें इंजरी एक्सोन को होती है, एंडोन्यूरियम को होती है, पेरिन्यूरियम को होती है, पर एपिन्यूरियम जो है वो इंटेक्ट होता है। ओके, अगर फिफ्थ डिग्री इंजरी है तो वो थ्रू एंड थ्रू कट है। ओके, तो द करेक्ट आंसर हियर इज फर्स्ट डिग्री नर्व इंजरी की, जिसमें कंप्रेशन की वजह से टिंगलिंग एंड नमनेस हुआ है। सेकेंड, थर्ड एंड फोर्थ डिग्री ऑफ इंजरी इन्वॉल्व्स द इंजरी टू द एक्सोन। सेकेंड डिग्री में कैप्सुलेटिंग स्ट्रक्चर है, उसमें कोई प्रॉब्लम नहीं होता। थर्ड डिग्री इंजरी है, उसमें एक्सोन और एंडोन्यूरियम जो है वो डैमेज्ड है, पर उसके अलावा दूसरा पार्ट एपिन्यूरियम और पेरिन्यूरियम जो है वो इंटैक्ट होता है। फोर्थ डिग्री इंजरी है, उसमें एक्सोन, एंडोन्यूरियम और पेरिन्यूरियम डिस्टर्बटेड है, पर एपिन्यूरियम जो है वो इंटैक्ट होता है।
So by finding out the cause, you can easily classify the types of injury. Okay.
Thank you for your words.
के लिए what is the
Ideal time is always it. Whatever you want to do, the right time is start now.
we have explained in the beginning of this lecture that
Yes.
Whenever you start studying physiology here in this platform of Unacademy, we are teaching students to prepare the topic as well as MCQs, so that enhances your preparation for university exams as well as for NEET PG also. So this is a very good platform for
when
both
you
the
really
kids.
want to do something, time is now. Right.
So now next is 25-year-old male is diagnosed with Duchenne muscle dystrophy. Which of the following protein is absent? And your options are A. titin, B. tropomyosin, C. dystrophin, and D. that is desmin. Now let me explain. Here you can see first what is titin. This is largest protein which is responsible for elasticity of muscle, and this connects your, you can see here, if this is your sarcomere, this is Z line, this is in center, there is M line. So this TT, that is scaffolding protein, it connects your this Z line to M line, this one. Okay, so this is anchoring protein, it gives support. Okay, then next is your tropomyosin. Tropomyosin and troponin, these are regulatory proteins. Okay, so they play an important role to prevent binding of myosin head with the actin. So this is for normal muscle contraction they are required. Now we come to your dystrophin. Dystrophin, that is a protein which is important for the strength of sarcolemma. Why? Because this dystrophin that connects or that transfers this different kinds of this strength, or you can say the different type of this stress which is given to your actin, mainly thin filaments, to the sarcolemma. So this is dystrophin, and when this dystrophin is absent, that results in your this Duchenne muscular dystrophy. This Duchenne muscular dystrophy, that is sex-linked recessive disorder, and that is because of absence of gene product dystrophin, and this gene product is present on the X chromosome. Okay, and that is this dystrophin, as I told you, it is important for stability of sarcolemma. Okay, because this force has been transferred from thin filament to the dystroglycan. I taught you with the lecture that dystroglycan to which this force is transferred. Okay, and last one, that is desmin. Now what is this desmin? That is intermediate filament of the muscle which connects, you can see here, this Z line to the plasma membrane. Suppose this is your plasma membrane, so here Z line to the plasma membrane is connected by this protein desmin. This is intermediate filament. So your correct answer for this question, that is dystrophin. Okay. Now, and In this Duchenne muscle dystrophy, common symptoms, clinical features that the person is having muscle weakness and pseudo hypertrophy. There is hypertrophy, but the muscle is not, there is no increase in the strength. Normally when there is hypertrophy, strength of the muscle increases, but here this is known as pseudo hypertrophy.
Sure, Adarsh. We will surely discuss NEET PG.
Previous year questions.
Previous year
Okay.
questions also. This is these MCQs we prepared by ourselves to just give you idea about to the students that how the MCQs can be formatted or it can be asked.
One more thing, every time we are giving you practice regarding all the MCQs along with the topic. So if you are regularly watching our videos and regularly you are connected with us, you will definitely get this MCQ practice. Okay.
Okay, now the next question. See, here 50-year-old male diagnosed with Lambert Eaten syndrome. Which is the pathophysiology? What is the pathophysiology of the disease? See, this way retrogradely also question can come. Okay, कि भाई आपको diagnosis already दिया हुआ है. Okay, आपको pathophysiology पूछा हुआ है. Okay, so physiology is like mother. So like it can come as a in a retrograde way also, right? So now let us see the options. Antibodies against acetylcholine receptors at postsynaptic membrane of neuromuscular junction. Antibodies against voltage gated calcium channels at presynaptic membrane of neuromuscular junction. Antibodies against voltage gated sodium channels at postsynaptic membrane of neuromuscular junction. Antibodies against voltage gated potassium channel at postsynaptic membrane of neuromuscular junction. So in short अगर हम इसमें देखें तो 4 ऑप्शंस दिए हैं जिसमें अलग अलग या तो 2 चैनल की 3 चैनल की बात की है और एक रिसेप्टर की बात की है, राइट? एसिटाइल कोलाइन रिसेप्टर की बात की है और 3 चैनल कैल्शियम, सोडियम और पोटेशियम की बात की है, right? So the correct answer here is it is because of the antibodies against voltage gated calcium channel. Okay, calcium channel at presynaptic membrane of neuromuscular junction. Now why this, what it will cause here? Because of the presynaptic membrane.
Here presynaptic.
So here I would like to draw something for you. Is this is the presynaptic membrane. Here there are calcium channels.
There is
Okay.
one comment just.
Okay.
Adarsh is asking that, ma'am, one session on step-by-step guide after MBBS, like what are the possibilities, act and all things. Please, most needed session.
Sure,
what are
we will
possibilities?
do.
Okay, after
Surely we will do this.
definitely.
We will keep this point in our mind.
Okay, fine. That's fine.
Okay, so in Lambert Eaten syndrome, there are antibodies against voltage gated calcium channel. Now, what happened here is because of the antibodies. See here at the for the release of the neurotransmitters. Okay, neurotransmitter acetylcholine from presynaptic terminal, we need entry of calcium. Okay, so if this is blocked, okay, or if there are antibodies against this, in that case acetylcholine release itself will be inhibited from presynaptic membrane. So rest of the mechanisms of neuromuscular junctions will be hampered. Okay, so the correct answer here is it is Lambert Eaten syndrome. In that calcium channel, voltage gated calcium channels, antibodies will be against that, and these calcium channels are located at presynaptic membrane of neuromuscular junction.
Now, next MCQ, that is a 50-year-old male diagnosed with malignant hyperthermia, which causes excess release of calcium ion from sarcoplasmic reticulum and leads to excessive muscle contraction. Now here, the question is mutation of which of the following is responsible for this clinical condition. Okay. Now, So, and your options are: one is ryanodine receptor, second is dihydropyridine receptor, third is acetylcholine receptor, and fourth, that is none of the above. Okay. So here, this malignant hyperthermia, this is autosomal dominant disorder, disease, and that is because of mutation of gene for ryanodine receptor. So here itself this shows that, and when there is mutation of gene for this receptors, what happens? There is excessive release of calcium ions. So when large amount of calcium ion is released from sarcoplasmic reticulum, as it is said that there is excessive muscle contraction, and that results in increase in the temperature, and that is manifested as malignant hyperthermia. Okay, this dihydropyridine receptor, these are voltage sensor. Here in this malignant hyperthermia, no mutation for the gene for this receptors, as well as this acetylcholine receptors, they are present at the neuromuscular junction, and here these are affected in the disease myasthenia gravis. So this also would not be the answer. Okay, so your answer is ryanodine receptor. Another applied aspect here is this disease malignant hyperthermia, that is treated by ryanodine receptor blocker. Okay, and the name of the drug, that is dantrolene. You can write down the name.
This
also.
is very important what ma'am said.
Dantrolene.
Yes.
Okay, so this is the blocker of ryanodine receptor. Okay.
So in this actually 2 MCQs are covered, malignant hyperthermia and the pharmacology part, that is dantrolene, as ma'am said.
Okay. Any comment here? What is the?
Yes. Surely, others, we are going to have one joint session on about the strategies, and
Based on
definitely
your
you just
experience.
yes, we will definitely share our experience with you. One strategy sessions we are going to have after this, that that we will be taking it together. And definitely all these points what you have said, I will keep it in a mind. We will keep it in a mind. And
you are in which year? First, second, or final year MBBS? Let us know. Then we can guide you properly. Okay. Next question.
So now come to the next question. 50-year-old lady underwent BOTOX treatment, okay, to reduce the wrinkles on the face. Which of the following drug is injected for the treatment? See the question carefully. BOTOX treatment is given, okay. So the options are curare, succinylcholine, botulinum toxin, or neostigmine. The correct answer here is C, botulinum toxin. Okay. Now,
so ma'am takes session on that tomorrow. What is her advice you both to give MBBS student based on your experience? We'll try to manage the session. We cannot promise you for the day, but we'll definitely try to take a session. Okay. Just started MBBS. Then
okay,
you are
so you follow us on Unacademy Future Doctors.
So you are getting this session at right time. So you continue.
Unacademy Future Doctors.
So
continue with this.
Continue with us, and you will definitely find your boost up in your career. I can definitely say that, because we were not guided in this systemic way during our MBBS. At present, I can say this thing only, that you will get benefited.
Okay, now come to the options: curare, succinylcholine, botulinum toxin, and neostigmine. So here the correct answer is botulinum toxin. Botulinum toxin, what it will do? It will inhibit the release of acetylcholine, and it is useful in the condition that is characterized by excessive muscle contraction. Okay, so here it will release the wrinkle because it will cause inhibition of the release of acetylcholine. So excessive muscle contraction won't be there. Okay, so correct answer is botulinum toxin. Acetylcholine, curare competes with the nicotinic acetylcholine receptors. Okay, and if the amount of curare is more than acetylcholine, it competes with acetylcholine for the receptors on motor end plate, and it will form a strong complex with them. Succinylcholine is a drug like acetylcholine, and it will cause depolarization of postsynaptic membrane at neuromuscular junction. So it will cause local energy exhaustion with no further generation of ATP. Okay, thus resulting in the muscle relaxation. It will cause muscle relaxation. Okay, so these are not destroyed by the choline esterase, and so muscle remains in the depolarized state for a long time. Then neostigmine drugs like neostigmine, physostigmine, they inactivates the enzyme acetylcholine esterase. They inactivate the enzyme acetylcholine esterase and stimulate the neuromuscular junction. So this is also not a drug of choice. So here the correct answer is botulinum toxin.
Next question is a 30-year-old male diagnosed with infertility, okay? And on clinical examination, heart is found on the right side. So which of the following is most likely diagnosis of the condition? Okay? And your options are A, that is Charcot-Marie-Tooth disease type 1A. Option B, Carter-Jenner syndrome. Option C, Guillain-Barré syndrome. And option D, none of the above. Okay, so here first one, this is Charcot-Marie-Tooth disease type 1. What happens here? This is autosomal dominant disease. Autosomal dominant disease. It is because of mutation of peripheral myelin protein. Okay, peripheral myelin protein, and that is characterized by mononeuropathy. Okay, so here there is no situs inversus. That is, situs inversus means your heart is on the right side. Okay, then next one, this is Carter-Jenner syndrome. Here it is characterized by, this is a syndrome, so it has different clinical features. Syndrome, so here triad, 3 clinical features are there. Number 1, that is situs inversus, means you can see that at the time of rotation of gut there is defect, so there is heart is on the right side. So this is one.
All the structures of the left side will be on the right side.
So situs inversus. Also the person is having, second thing is sinusitis, recurrent sinusitis, because ciliary activity is reduced. Sinusitis, sorry. And third, that is bronchiectasis. Okay, these are the clinical features. Okay, along with that, because of decreased motility of cilia, sperm movement is also affected, and that results in infertility. So your answer would be the Carter-Jenner syndrome. Another option, this Guillain-Barré syndrome. Here immune system, what is the pathogenesis here? Immune system attacks on the nerve, and because of that the cause is idiopathic, and because of that the person is having tingling, person is also having weakness in the extremity. Okay, and so your option is B. Okay,
Right answer is
Right.
B, Carter-Jenner syndrome. Okay, now come to the next MCQ. 55-year-old female receiving treatment with calcium channel blocker for hypertension. Okay, calcium channel blocker for hypertension. Which of the following are blocked by calcium channel blocker drug, or you can say medicine? Which one will be blocked? Ryanodine receptor, acetylcholine receptor, potassium channel, or dihydropyridine receptor. See, there are 3 receptors and 1 channel name is given. So here the correct answer is dihydropyridine receptors. Okay, as just now we discussed that dihydropyridine receptors are present on T tubules, right? They are present on T tubules. These are calcium channels. Okay, they are calcium channels. In response to the depolarization, muscle depolarization, dihydropyridine receptor will act as a sensor. It will act as a sensor and make the physical interaction with the calcium channel in sarcoplasmic reticulum. Okay, that is ryanodine receptor. Okay, so this mechanism, this entire mechanism is blocked. Okay, when you block dihydropyridine receptor, this entire mechanism will get blocked. It means that sensing the depolarization process and releasing the calcium, okay, from rhinodine receptors, these things will be blocked. Okay, so the correct answer is dihydropyridine receptors. Rhinodine receptor, as I said, they are present in the sarcoplasmic reticulum. Potassium channel acetylcholine receptor site are very different. Okay, so here the correct answer is dihydropyridine receptor.
Uh, mm,
Yes,
I feel
Adarsh.
difficulty in solving clinical questions because
So this is the way we are solving the MCQs together, right? So we are separating, see, like let's take an example of something, some very simple MCQ here is this.
Hmm.
So here's very first I will say the feedback mechanism is very in the beginning of the 10th day of your medical college you may find this topic,
Okay,
right?
okay.
So this is the way you can crack the MCQ. Yes, ma'am.
You can also go through previous year questions as we have discussed that previous year questions, MCQs if you solve. Here also we are giving you practice regarding all these MCQs. So just as I told you, stay with us and you will get whole practice. You will get the whole syllabus completed here. So if you are regular watching us, then I think so you won't be having any problem because we are teaching you topic as well as MCQs simultaneously.
Yes, finding the correct answer of the MCQ, same time finding the distractors, that this is something with which I am not supposed to confuse is very very important. क्योंकि बहुत बार ऐसा होता है कि confusion इतना create होता है mind में कि जो distractor होता है ना, you feel that कि यही correct answer है और आप correct answer select नहीं करते और कोई wrong ही आप pick कर देते हो.
Today in this session we have just tried to give sample of MCQs, only
sample.
10. Otherwise in our other sessions in 35-40 minutes we are trying to crack or solve around 40 MCQs. So if you just open your book and try to solve, you can't be able to solve 40-50 MCQs in 1 hour. So this is a better practice for you people if you are following us. Suppose we are taking our special classes, you can find our special classes on app also. On app most of the time we are taking MCQ, so just go to app and find out. You can follow us as well as you can find out MCQ topics. If you are new for the app, this is just to guide you also, that suppose if you have learners app and you just have to write down name of the educator. Suppose if you want to want to learn MCQs from physiology, so write down name of me or Dr. Shital, and whatever classes,
Whatever
whichever
educator
classes,
you want, yes, you
whichever
want to
classes
follow.
we have taken, that will come. Suppose if you want to do MCQs, 50 MCQs, so you just go to the topic name is also given, that MCQ from muscle, MCQ from this system. So you just can do the same also. Guide for first year practical also.
Here we are going to cover theory part. Here
Because we have certain limitations in
Yes.
live classes. We cannot be able to demonstrate everything.
Yes, so here we are on the platform of Unacademy. We are going to have the physiology theory aspects we will be teaching you. This is all about the sample questions. These all MCQs were prepared by us and we tried to solve out everything. We definitely took this suggestion and that we will be taking MCQs. These some references we were taken while preparing this MCQ from the previous year questions also. But now, as you said, we will definitely take the question paper itself and we will help you to solve this. Okay, so this is, you can say, another way of learning. Okay, that when you clear the MCQ, when you solve the MCQ, not just knowing the right answer but also knowing about why the other answers are wrong, so it will help you.
Okay, so thank you all. Thanks for being with us.
Yes, study hard, study with us. Subscribe Unacademy Future Doctor channel and help us to reach us more and more number of students. You can attend the special classes by me and by Dr. Dipti on the platform. You can use the promo code Shital10
Dipti10
to get the direct access for the special classes by us. Thank you so much.
Thank you. There is some comment.
Adarsh, class, you just subscribe this channel, you will receive the notification. Hit the bell icon whenever we go live. You will get the notification that Dr. Dipti or Dr. Shital is having live class right now. You can download the app. जब आप download करेंगे, and that time also you will receive the notification that so and so educator is live right now.
One more thing, in app you just go to NEET PG course. Okay, so sometimes
so-
students make mistake that don't write down NEET UG, write down NEET PG. Although you are first MBBS student,
Yes.
write down NEET PG, and
Yes.
you will get all
have
the
access to the
notifications.
educator. So whenever we go live, you will receive the notification.
So subscription and hit the bell icon here. Just
Yes.
this is shown here. That
Yes, you are
subscription
you are
and
supposed to subscribe. It's free. This app YouTube channel is free. Just hit the bell icon so you will receive the notification. Thank you so much.
okay. Thank you.